This is the third and final video in this little trio of reset videos that I've been creating for our partners like you. 3 powerful things have come together for me in the last 6 months. I've already shared the first 2 with you. The first was the calling that God put on our hearts to join HealthBridge Global in a fully committed manner. The second was the fresh understanding that God's given me about the powerful potential of medicine as ministry when strategically and intentionally done in the name and in the character of Christ. And I want to share the third one with you now. For the past few years, HealthBridge Global has been focused primarily in Romania with our long-term and, might I add, fantastic partners there. Some of you have even met Dr. David personally. We've also dabbled in some support of eye care and dental clinics in India. But when Becca and I started HealthBridge Global, we never intended it to serve only a small handful of projects overseas. We always knew that the vision was bigger, and we desired to see a deeper impact. But it wasn't until more recently, when I committed myself fully to this work, that God began to make that vision clear to me. And here it is. I call it our 20-10-10 vision. Our vision is to plant 20 healthcare projects in 10 nations in the next 10 years. These healthcare projects will be of varying size, scope, and specialty. They'll look different based on the needs of the community they're in and the leaders who we partner with. Let me quickly define what a healthcare project means to us at HealthBridge Global. First, projects must be gospel-centric. Let me say that again, gospel-centric. Let me say it a third time. Just kidding. You get the point. We're not out to only improve people's health in a temporary and only a physical nature. Humans are body, soul, and spirit. We want to bring the whole gospel to the whole person. Second, projects must be locally led by doctors, nurses, and healthcare professionals who have their own vision for how God wants them to impact their communities. We don't bring the ideas. We get behind those who already have them. Third, our projects must meet a real healthcare need in a community so that we help raise the total tide of blessing in the areas that we serve. Fourth, our projects must be economically viable or financially sustainable. We want to create healthcare projects that employ people and create tax revenue for the community. Projects that can outlast our ability to be involved. We want to help create impact for decades and generations to come. So by focusing on projects with these 4 markers, it enables us to have a gospel impact, an economic impact, and a social impact. Sort of like a triple bottom line. So 20, 10, 10. 20 projects in 10 nations in 10 years. That's our vision. And we're going after it. God's already opening doors. I've been invited to go visit 2 locations in North Africa that for now should probably remain undisclosed. But I'll be there in November to meet with visionary local healthcare leaders so that we can try to determine whether or not these would be good partnerships for us to come alongside. I'll keep you updated on that trip both before, during, and after. I'm also hoping to make a trip to India in the early part of 2022 to explore some additional opportunities there. 20, 10, 10. Are you with us? Will you help us fulfill this vision? I invite you in on the challenge, and God will ensure that you also share in the blessing. Let's go.